Hi, my name is Kenneth Patine, and I'm here today to talk to you about adult mesenchymal stem cell therapies. The question is, why have orthopedic surgery when you can have stem cell therapy? Now, recently, several famous people and professional athletes have undergone stem cell therapy for injuries in their bodies. These include Governor Rick Perry from Texas, and my favorite, Peyton Manning, quarterback of the Indianapolis Colts. Stem cells are early stage cells. These are cells that can differentiate into other types of cells. I want to differentiate what we're talking about today, adult mesenchymal stem cells, with what you probably have heard of as embryonic stem cells. Now, embryonic stem cells are cells that are only in your body for a few weeks after fertilization. These come from the blastocyst. These cells are totipotent and can become any type of cell in your body. These are very different than adult mesenchymal stem cells that we're talking about today. Now, adult stem cells can become various types of cells in your body. An example of that are red blood cells. Red blood cells last about 120 days in your body. So you have a stem cell that produces the red blood cells that are replaced every 120 days. The cells we're talking about today, the mesenchymal stem cells, can only become three types of cells: cartilage cells, bone cells, and connective tissue. Now, mesenchymal stem cells are found in the bone marrow, and these are the primary cells that are used in orthopedics and spine. It's important to realize that the number of these cells decreases as you get older. As an example, the newborn, about 1 out of every 10,000 bone marrow cells is a mesenchymal stem cell. Whereas if you get to be my age, only about 1 out of 400,000 of the cells in your bone marrow are actually the mesenchymal stem cell. What we are doing is to emphasize or utilize your natural healing in your body. So we're placing your stem cells into damaged areas of your body to promote natural healing. And the goal is to harness the power in your own body to do this. There have been no reports of any adverse effects of utilizing these mesenchymal stem cells from your own body into damaged areas of your body to promote natural healing. So there are currently three types of stem cell therapies available. The first one is not FDA approved. This is where cells are taken from someone else and then transported in a frozen state and then injected into you. The second type of therapy is also not FDA approved. And this is where these cells are taken from your body and then transported to a laboratory where they're placed in a petri dish, expanded, and then injected back into you several weeks later. The third type of therapy is FDA approved, and that's the therapy we're talking about today. And this is where these cells are taken from your body, they're placed in a concentrator called the ART21, and then placed back into you in damaged areas of your body. This is a picture of how this is achieved. A needle is placed into your iliac wing, and this aspirate is then removed from the iliac wing and concentrated. Once these cells have undergone this procedure, you can see what they look like. And it's quite interesting, the layers of cells, and the layer we're most interested in is the white area. This demonstrates the ART21 concentration system. So this is a very sophisticated centrifuge that allows us to take that 60 cc's of fluid from you and concentrate out just the mesenchymal stem cells without damaging them. This is a picture of the cells, and you can see the one layer we're most interested in is where the mesenchymal stem cells are. And the ART21 allows us to do this in a manner that does not damage these cells. The purpose is to promote natural healing. At the Orthopedic Stem Cell Institute, as a patient, you would be admitted, an IV would be begun, and you're given sedation and then taken to an operating room where under sterile conditions, with your skin anesthetized, this needle is then placed into your iliac wing. The fluid is extracted, placed into the ART21 concentrator, and the mesenchymal stem cells are then removed and then placed back into your body in damaged areas to promote natural healing. This whole procedure takes about 30 minutes. At the Orthopedic Stem Cell Institute, these cells can be placed into various parts of your body, including your cervical spine, in damaged discs, in the lumbar spine, in damaged discs, also in all types of joints, including the shoulder, hip, knee, ankle, and in tendons. I want to emphasize that there have been no reports of any adverse effects from the utilization of your mesenchymal stem cells into your own body. What we're attempting to do is promote natural healing. These cells are pluripotent and can differentiate into cartilage cells to promote the natural healing of damaged discs, joints, and tendons. The results thus far are very promising. This technology has been used for numerous years in veterinary medicine. It's also been studied in animals and recently in human applications. Thank you very much for your attention.